Welcome to Gamble with Brandl. Today we have a 54-year-old woman that is seen by her physician because of difficulties of getting out of the chair and also because of a tremor in her left hand. Which of the following would you recommend as an initial treatment? So we have here a couple of choices. So let's first think about this case. So we have someone that has problems getting out of the chair. So that's probably some sort of slower movements, which we refer as brady, slow kinesia movement. And then also a resting tremor. Well, resting tremor, bradykinesia, that sounds like Parkinson's disease. So we are dealing here with a Parkinson's disease patient. And which of the following would be options to treat Parkinson's disease? So let's think about that. Propranolol, that's a treatment for essential tremor, ET, essential tremor. Remember, the difference in terms of the tremor is that for essential tremor, the tremor is at the end of a movement, a goal-directed movement. So if I hand over someone a cup of water and at the end of the movement I have a tremor, so a goal-directed movement, and then the end you have a tremor. That's essential tremor in contrast to a resting tremor, which is more indicative of Parkinson's disease. Carbidopa, levodopa, definitively a Parkinson's disease treatment option. The golden standard. Phenytoin is an anti-seizure medication, so that would not fit, so we can get rid of this here and this here. And then trihexyphenidyl is an anti-muscarinic drug, which can also be used to treat Parkinson's disease. Why? Because in the substantia nigra, you usually have this balance between dopamine and acetylcholine. And if somebody with Parkinson's disease, they lose dopaminergic neurons, so you're going to have this imbalance. There's too much acetylcholine in contrast to the dopamine, so we're going to use an anti-muscarinic to bring this neurotransmitter back in balance. So we have two options in terms of treatment, two Parkinson's disease medications for our case here, carbidopa, levodopa, and trihexyphenidyl. So how can we come up with a correct solution here? So we have to also consider the age of the patient. The patient is rather young for Parkinson and has the tremor as a chief complaint. There's not yet any cognitive impairment, at least as far as we know. So it turns out that for the treatment of a younger patient, when tremor is really the chief complaint, you're going to go for a anti-muscarinic. So in that case, trihexyphenidyl is the correct answer. Now, carbidopa, levodopa is the golden standard of treatment of Parkinson's disease. However, we want to use it as late as possible, because generally it just helps for a couple of years, does fairly well job, but we don't want to start as soon as possible. So in this patient, a rather young patient, we would go for an anti-muscarinic first, and then later, maybe if the disease gets worse, there's more bradykinesia, there's cognitive impairment, then we would go for the carbidopa, levodopa.